can you help me? I know you guys do herniated discs. He says, what are you talking about? He says, first of all, and this was the first bit of education I got from a chiropractor that ended up being my mentor and the main reason I went to chiropractic school. He said, we don't treat anything, Yoni. He said, we care for your spine. We correct subluxations. And, you know, do you want to get better? And I was obviously like, I'm like, well, yeah, that's why I'm here. I want to get better. He says, well, if you want to get better, hop up on this table. So So today we're going to talk about, can chiropractic help a herniated disc? And interestingly enough, actually, I had a herniated disc from a weightlifting accident, or you could say the weightlifting accident was, per se, the straw that broke the camel's back. Trying to do a clean and jerk during warm-up exercise at CrossFit. And that was how I decided I was going to become a chiropractor. So I just wanted to share this short story with you. You'll actually hear the longer version on one of my podcasts. If you go to my website at drpearlmantv.com, if you gain something from this, is, I had a herniated disc. I had an MRI. It showed a bulge and a tear called an annular tear. And that's on the disc. The disc is obviously, the jelly donut, if you will, that it's like works as a shock absorber, right? As many of the back specialists would tell you when you're in the orthopedic surgeon, you go to the chiropractor, you go to your physical therapist, or you go to your spinal surgeon if you've had experience with herniated disc or a bulging disc before and you are worried about it. If you've had surgery, maybe you're watching this video if you have had surgery and it hasn't really alleviated your symptoms. Maybe you're watching this video because you yourself herniated a disc, or you got told you had a herniated disc, or you have pain radiating down your leg, which is indicative of a herniated disc pressing on a nerve. So what happened was I was diving under the bar for that 135-pound clean, which was warm-up weight then. This is about 12 years ago-ish, and couldn't get back up. Heard a big pop, worst pain ever, radiating down my glutes and into my leg. Really, just a devastating injury. Kept me out of work. I was bartending at the time and going to school. Couldn't go to class. Couldn't go to work. I was useless. And I went to the spinal surgeon, and he told me that I was young and I could probably recover from having 2 bulged discs and 2 tears in L4, L5, L5S1 disc. And he said, that likely due to some arthritis, that it was a pre-existing condition, and this was the straw that broke the camel's back, but I was too young for surgery. So I went to physical therapy based on his recommendation. They had me roll around on, those big, I think they're called Bosu balls. I did a lot of exercises, some that are even good now that I recommend to patients, called, bird dogs. We did some glute bridges. Things that, ended up not really working for me in the short term. I still had pain radiating down my left leg all the way to my little toe, and it was bad. And I remember going to the acupuncturist because I was told to me by the spinal surgeon at the time, or by the back specialist over there in New England. I'm from Providence, Rhode Island, and living there at the time. And he said, chiropractic isn't going to be able to help you with your bulge disc. He might be able to, help with the joints when they're a little achy, but he's certainly not going to be able to help you with this herniated disc. And it's just going to take time, a lot of commitment to exercise. And then if it didn't help, that surgery was going to be my last option. So acupuncture didn't help. Massage definitely didn't help. That was really painful at that time for me, in my experience. Somebody was using almost like a Swedish or a sports massage. I know those are two different things now, but it didn't help. So I went to my chiropractor, who at the time I hadn't seen in about 6 to 8 months, but I had seen him previous to CrossFit because I had some back pain from working in construction all the time. And what happened was I got over that back pain relatively fast from an incident carrying a ladder. And I just went to him, and this is in the worst pain for well over a week at this point. And I said, can you help me? I know you guys don't do herniated discs." He says, "What are you talking about?" He says, "First of all," and this was the first bit of education I got from a chiropractor that ended up being my mentor and the main reason I went to chiropractic school. He said, "We don't treat anything, Yoni." He said, "You know, we care for your spine. We correct subluxations, and you know, do you want to get better?" And I was obviously like, I'm like, "Well, yeah, that's why I'm here. I want to get better." He says, well, if you want to get better, hop up on this table." I said, "Okay." So just like that, I put my trust into him. He did a little bit of feeling around by my low back. I said, "Oh yeah, going in that direction hurts. Going in this direction doesn't." He had already had my X-rays and he saw then my MRI. He said, "All right." He's like, "Just relax. We'll get you better." And he puts me in, what I have a lot of patients tell me is the pretzel, what we call the side posture maneuver. Before I could even talk about, what I'd had for breakfast, the biggest, loudest gunshot audible, whap, in my low back, just whoa, screamed. Uh, I didn't even know what just happened, but got up off the table, walked around, and I guess I was kind of like a little bit in shock because I'd never felt something quite like that while being in pain before. And I had immediate relief to where the pain that was or the tingling that was in my pinky toe had subsided to where all I felt was, this residual pain in the side of my butt and just a little bit in my back. Okay. I didn't think, I was told you didn't, take care of herniated discs, didn't treat herniated discs. He says, "Well, what I just did was I corrected very specifically a subluxation in your back. And, why don't you walk around?" He's like, "If it's still bothering you a little bit, come back tomorrow, but just, kind of take it easy. Don't go do CrossFit now." He knew I was anxious to go CrossFit. And yeah, off I went. On the way back toward the car, I mean, we're talking going from about, at that time, I guess I wasn't a 10 in pain. I'd probably be about like an 8 in pain. And I was probably about a 2 on the way back to the car. I mean, I was tempted to go do CrossFit. So the next day, I was feeling great. I go to him in the morning. I'm like in zero pain. I had the best night of sleep I've had in almost 2 weeks. He looks at me again. He says, "Let's go ahead and give it one more adjustment." Puts me back in the same position, way lighter. Get a little click. He's a little snap. Not even. I said, "Okay." He says, "All right." He says, "You're gonna be good for now for a while." He said, "Do your exercises. Don't bend over or do any heavy deadlifting. Be careful." He showed me a couple of things with some stretches, which was actually counterintuitive, if you will. It was, I didn't think you're supposed to stretch like that. I thought it was because I had all these, tight hamstrings, and it was because of my, my glutes and my sciatic nerve. And apparently for me, that couldn't have been farther from the truth because I went back to CrossFit later that night and I did some of the stretches he told me. I lifted very little weights, just kind of conditioning with some deadlifts, did a little bit of running around the gym, doing some pull-ups. And by the next few days, I mean, I was almost back to full bore. And I mean, by that time, I mean, the second adjustment, I was in out of zero pain. I had no more symptoms going down my leg. I had no more feeling of tingling in my foot. And that was my introduction to the powers of chiropractic and what it could do when being in a serious acute situation. Now, that is at least, the story of my, herniated disc, my own personal experience, and how a chiropractor saved me and got me out of pain when nobody else could, when it came to a herniated disc situation in my low back. There's obviously astounding, overwhelming evidence as to how chiropractic manipulation or spinal manipulation therapy for your low back helps in situations like this. Um, all I can say is yes, astoundingly, in my experience, and there's lots of evidence to support it, chiropractic does work with discs. They do care for people that are in acute pain or even chronic pain related to bulging disc, torn disc, herniated disc. I think the biggest thing and the takeaway message from this video will be always go to someone who is a chiropractor that has been recommended to you from a friend. See a chiropractor that is reputable, not just with good Google reviews, but that you see him or her personally, They are talking to you, they are interacting with you, they are listening to you, they have compassion. You are jiving with them. Build a relationship, make sure they are there for you. And of course, their technique should be flawless. And that you'll only know if you feel better after you've been adjusted. So I just want to put that out there. This is Dr. Pearlman coming to you from Richardson, Texas. I can't wait to see you. If you're from the Dallas-Fort Worth area and you're seeking Gonstead chiropractic care and specific adjusting, I think our clinic would be a great fit for you. Just have a great day.